Hi, I'm Enchanting Nubianette. Welcome back. And if you're new to my channel, welcome. Well, today let's talk about a new method, a modern method of the Japanese growing teeth. Now, yes, you heard that right. Now, this isn't a standard yet. It's not a standard commercial dental treatment. It's experimental. However, it's cutting edge and it's currently in clinical trial phases. So, meaning, usually with these medical trials, they start with animals. From what I know, mice, for example, and then continue on with, humans. They look to see what are the side effects, how it affects the human body, how it processes in the bloodstream, and so forth. So that can continue on for several years. But yes, Japanese researchers have made headlines by proposing a drug-based method to regrow natural teeth in people who have lost them. So this is what I have been reading online. Now, a team led by Dr. Katsu Takahashi at the Medical Research Institute, the Katano Hospital in Osaka. This doctor has focused on a gene protein called the USAG-1, the uterine sensitization, associated gene 1. Now, the USA gene 1 acts in part like a brake on the tooth development. Now, by inhibiting or neutralizing USAG-1, researchers are really hoping to release these dormant tooth buds, or what we can call it a third set of potential buds, and let them develop into full teeth. So everyone, I was so baffled by this, because we know we have two sets of teeth. We all have them, those of us, who are blessed to have, healthy teeth, but who knew that they can be a third set? Now, as I mentioned a few minutes ago, animal trials have shown promising results, such as in mice and even ferrets, in blocking the USAG-1, which led to the growth of new teeth or the activation of otherwise tooth germs. So starting in October 2024, the human trials began, and that was, of course, in adults. I haven't heard of many trials in children, using children, but these are in adults, and it tested the safety, the dosing amount, like how many milligrams that these humans should get, what is safe for the internal organs as well, and even early efficacy of the drug in humans missing one or more teeth. So if things go well, the doctors and the research team, they aim for a broader usage of humans utilizing this medicine around 2030. So just imagine, everyone, there's like a human seed tooth buds under our gums that normally never get activated past childhood. So the USAG-1 protein says, nah, stop, no more teeth growth. However, the Japanese team is saying yes, and they're developing an antibody, a targeted molecular therapy to block the USAG-1, basically lifting that stop and allowing those seeds to wake up and grow a new tooth. This is amazing. I've been watching, TikTok, and I've been seeing many videos with people who are using, I don't know if it's a silicone material, but it's some type of material that they're actually putting in near their gum because they have a missing side tooth. So just imagine if they were to use a drug like this and actually have their tooth grown back. Now also, this isn't about scaffolding or implanting tooth parts. Okay? Though other regenerative dentistry approaches do involve stem cells and scaffolds. But this is more like turning off a suppressor so that your body can do the job more naturally. It's not simple, but according to them and according to this research, it's what we can look for in the near future. So everyone, thinking about our body's development like a construction site. Like in childhood, we know we have many projects, for example. If we were to think this way, we have our teeth, we have bones and organs, and we're in built mode. But, as we reach maturity, 18 and over, some of these projects, they get locked down or suppressed, so they cannot keep building forever. Now, in our gums and in our jaws, there have these tooth germ buds that didn't finish growing. They were suppressed before full activation. So these are like abandoned building foundations, for example, that never become full houses. The USAG-1 protein is like the security guard that says, stop, no more construction. However, the Japanese therapy is trying to disable or distract that security guard, the USAG-1, by letting the construction crew, this is the cellular growth, mineral deposition, and more, go ahead and build a full tooth, the root, the enamel, and everything. So think about it in that process. So now, for example, we would have a new tooth that can be grown to be functionable, meaning able to chew it, withstand a lot of forces, integrate in the jawbone, align properly with the neighboring teeth or teeth we already have. So this is phenomenal, It's amazing how much, science has been advancing so rapidly. So now let's think about some of the pros. Now, how this can be a game changer. So one, we have natural regeneration versus artificial implants that I know many people were, many people have, and many people had to contemplate and think about, how much money that costs. So if you can regrow your own tooth instead of putting in a titanium post or crown, that is a huge win. Natural tooth, that means the same material, sensitivity, and integration. And you don't have to think about any foreign implant, like any risk also of the implant rejection. You don't have to think about any infections or even mechanical failure. It's also less invasive. Now, compared to surgeries, there's gum grafts, implant placement, bone grafts. This is relatively non-invasive, like injection-based. And for many patients, this lowers recovery time. You don't have to stay out of work so long. You don't have to be in bed for so long or taking a lot of pain medication. And there's less complications. There's also a lot of potential for more affordability and accessibility in the long run. So if this becomes a standard therapy, and it might one day, it may be a lot cheaper than the complex implant surgeries, which require like high-tech equipment, multiple dentist visits, and of course, surgical skill. And then when we think of many communities that are underserved, this gives them more access to dental procedures. It definitely levels the playing field because the cost would be a lot lower. It can be more controlled. There's also a better biologic integration because if you're using your own tissue, it's not a foreign object. The new tooth will better respond to your bodily changes and maintain its own sensory feedback, just adaptable over time. So, and there, you know what? According to a lot of research, there are some people who are born with, teeth that are not very strong. So, this therapy will definitely help those people to develop those teeth naturally instead of having like a lot of gaps or prosthetics. Those are a lot of pros, everyone. Let's think about the cons or the challenges, the risk as well. So, again, thinking about safety. So, when you block a protein like the USAG-1, that protein likely has roles elsewhere, such as in the bone growth. Thinking about the internal organs like your kidney. Suppressing it could cause unintended effects. There is systemic injection that can affect the organs beyond the jaw. That could affect your immune system. That could affect many different areas in the body. Another con would be, control over the tooth form and the positioning of the tooth, the spacing. So even if the tooth forms, will it be in the right shape? Will it be a lot bigger or a lot smaller than your own regular teeth? What about the orientation of your teeth? For example, would it cause a lot of crowding or grow in other weird places in your mouth? That's another thing to think about. So we know the human mouth, just like our body, is very complex. We need everything to be aligned. Another factor would be like the dormant bud availability. So this method works best if those dormant third set of teeth remains in your gum. But what if you have lost the tooth or the germ seed over time, or your tissue is degenerated and there's no seed to even activate? What about the time to grow or the functional maturation of these teeth? How long will it take? So even after activation, a tooth must go through the different stages like mineralization, root formation. When we take out our teeth, well, I have taken out my 4 wisdom teeth. You see the root. Suppose there's a lot of eruption in the gum. That can even take years. Suppose during the growth it may be very weak or very vulnerable to damage. What should you do then? What should the dentist do then? Also, regulations regarding costs. So these clinical trials are ongoing, and it definitely takes a lot of time to get approval because, again, the safety, efficacy, long-term outcomes, and everyone, we're all unique. So different people may have different side effects, different type of, teeth buds. So many different aspects that may happen when, they take these medications. Even when it's first available, it could be very expensive. That's the usual case. Anything that's very new, it's always a lot higher in cost. So it can become limited to advanced dental centers or, wealthy. It could be available to wealthy people. Let's think also about insurance, because insurance reimbursement, even if you were to pay for it, and even the healthcare infrastructure lags behind. So if you pay for this type of procedure, it may take a very long time in order to get a refund. Okay, and other factors are who gets access to this first? What if only the rich or rich people would get it first? What are the long-term side effects? And again, the effects are not always known because it takes years in order for them to find out, the doctors to find out how it affects the body. Now, even thinking about animal model success doesn't always translate to human success, right? What worked for mice or ferrets could be a fail for humans. We don't know, the doctors don't know yet about the limitations. They have to work on, large molars or multi-rooted teeth? Will it work on those, or even people with different disease in their mouth, periodontal disease, or even bone loss, or different types of ailments that they have? So another con is maybe it's not a universal fix. Okay, so even if this becomes real, it's not always guaranteed to replace implants entirely. So in some cases, even if someone wants to have the drug, or if someone has taken a drug, if it doesn't work, they may still have to get implants or prosthetics. So this is very fascinating, everyone, because imagine 10 years from now, maybe our grandparents, well, not my grandparents, but someone who's a lot younger than me, a grandparent will no longer need dentures, or when someone in the community loses a tooth, it doesn't have to be painful or expensive implants. They can just get their own tooth grown back. This is extremely powerful. So I would love to learn more about, how this will advance and how it will be utilized. For example, in the next 5 years, you know, will humans really be able to regrow their teeth in about 5 years, or even, 10 years? This is very, very, very baffling. But don't ditch your dentist or implant just yet, because we still need them. Okay, so everyone, what do you think about this, modern health advanced research? Have you heard of this news story before? Please leave your comments. Please like, subscribe to my channel, and share my channel as well. Thank you for watching. Stay safe wherever you are, and definitely keep your head on a swivel at all times.